The method of taking sample from nasopharynx. Hello, what's your name? My name is Tursukular. May I see your passport, please? Yes, here you are. How old are you? 23. What's your address? Karasu 54. What's the telephone number? 8700. Do you work or study? I work at a bank. Why are you going to do PCR test? I need to do PCR test for traveling abroad. Is it your first time of making PCR test or have you done before? It's the first time. Do you have any symptoms or complaints such as fever or other discomforts? No, I don't have any complaints. I am taking PCR test just to go abroad. We are going to take sample from upper respiratory tract as you don't have any symptoms of COVID infection and it's your first time of taking PCR test. Med personnel who is going to take sample from you is Жолдасбек Adlet. I am going to take sample from upper respiratory tract to detect COVID-19. There are all instruments to take it. The first instrument is probe swab with special sign. And capped swab test tube. And the third thing is 0.9% sodium chloride solution or virological solution. Before taking sample, we mark tubes. The patient should sit in a relaxed and comfortable position during the sample collection process. Tilt patient's head back slightly and tell about during taking sample, it might be unpleasant. Ask patient to remove mask and other things that may distract. Nostrils are cleaned with a disposable cotton. We have to insert probe to measure distance between nostrils and auditory canal. Start by inserting the swab horizontally into left or right nostril carefully. Advance the swab while maintaining a course that's close to both sputum and floor of the nose parallel to the palate. Don't advance the swab upwards, but instead straight back until the resistance is felt as swab reaches the posterior nasopharynx. Leave the swab at the depth for 5-10 seconds, while gently wiping the wall by twisting the swab shaft slowly and gently remove the swab. Immediately insert the swab into the sample collection tube which contains sodium chloride. The method of taking sample from oral cavity. What's your name? Jambarova Shugula. Your passport, please. Here you are. How old are you? 18. Your address? RS City. Your telephone number? 8708. Do you work or study? I study in South Kazakhstan Medical Academy. Why are you going to take PCR test? I have returned from abroad, therefore I need PCR test results. Is it your first time? Or have you done before? It's the second time. Do you have any symptoms or complaints such as fever, weakness in muscles, or upper respiratory discomforts, problems? How do you feel? I don't have any symptoms. Okay, then we are going to take sample from your oral cavity. Med personnel who is going to take sample is Жолдасбек Adlet. To detect COVID-19 infection, we will take sample from patient's oral cavity. There are all instruments to take it. The first instrument is probe swab with special sign. And capped swab test tube and a disposable spatula. Additionally, we need 0.9% sodium chloride solution. Before taking smear from the oral cavity, we have to mark our tubes. We have to remove masks. Tilt patient's head backward, ask to open mouth and to stick out tongue. Depress the tongue with spatula gently, insert the sterile swab and rub it over the posterior pharynx area. Make sure that the swab makes good contact with tonsils and posterior wall of both sides. After that, immediately insert the swab into the sample collection tube with sodium chloride solution inside. Break down part of the swab which is not inserted into it. Then the tube is closed properly.